We now talk to the OCTA Research Group. Joining us is Dr. Guido David. Good morning, Dr. David. Thanks as always for joining us. Now, it's been projected before that there might be an increase in COVID cases post-elections. And now we have this confirmed news about the new Omicron subvariant BA.2.12.1 that is known to be more transmissible. So given this is the environment right now, have you monitored an increase in cases because of this?
Well, Ria, so far the good news is we haven't seen an increase in cases. We have been noting some clustering of cases in some areas. For example, in Palawan, we did see a cluster of cases. But so far, the numbers are still good. Hospitalization rate is still low, although anecdotally, I'm hearing from some doctors I know that they're starting to see a few more patients now than before. But we can't use this as evidence that there's an increase in cases yet. We're not saying that there will be no increase in cases. There might still be, especially as you mentioned, they have noted that the Omicron subvariant BA.2.12.1 has already been detected in several parts of the country.
Why do you think, Professor, we haven't seen an increase in cases so much, even though we know the subvariant is supposed to be extremely contagious?
Well, Ria, I think we still have the wall of immunity that we have built from vaccines and from the previous infections. But we can't depend on that wall of immunity forever because of waning immunity. And that's why the other medical experts have recommended the booster shots. Not just the medical experts, but also the local government chief executives. So this will help us keep our wall of immunity up and possibly prevent a surge or a resurge in cases.
Right. I think we have at least 17 confirmed cases of this subvariant, and the health department has said that there's already local transmission. So considering the transmissibility of this subvariant, should we expect cases to go up, and when?
Well, it's difficult to project when the cases will rise right now, Ria. It could happen anytime, actually. It could happen this week, or it could happen next month because of the wall of immunity breaking down. It has different timelines for different people. But I would also like to mention that so far we haven't detected the BA.4 and the BA.5, which were first detected in South Africa. They might be more of a concern because they have already been designated as variants of concern by the European CDC. And they were first detected in South Africa and causing a surge there. But as mentioned by some other doctors, even if we do see a surge now or in the foreseeable future, it won't be as bad as the January surge because partly we'll still have some wall of immunity, and because of the vaccinations, most of these cases will be mild, but nevertheless, it may still be disruptive to us.
Right. Nobody wants to go back to, what it was like in January. Right now, many parts of the country are still under the lower alert level 1. Do you think it's time officials consider once again tightening restrictions, or is that too soon?
Well, it could happen in the future, Ria, but as for now, it would be premature to tighten restrictions based on no evidence yet, or at least on suspicions of possible surge. We do still have to see an increase in numbers before we even raise the alert levels, and it does not seem likely that we will be going to a very strict alert level anytime in the future because of our vaccination rates. So it's possible we could get it up to alert level 2 if cases start to increase in hospitals, but I think that would be about it, more or less.
All right, Doctor, thank you so much for your expertise. That was OCTA Research Fellow Guido David.